right, so I am pretty excited this afternoon. I'm here with Carol, and Carol, why don't you tell us a little bit why you came into our office? Tell us a little bit about some of the things that I guess just caused you to reach out to us for help.
I felt like I was having problems with my thyroid mainly, and my energy levels were very low. I had some acid reflux issues, constipation, quite a few different things actually, digestive issues, and I was going to my regular doctors and they kind of poo-pooed some things and didn't want to do some tests, so I was getting very frustrated.
Yep.
And looking for a more natural way to achieve results.
And how'd you find out about us?
I think I saw it online, I believe,
like
yeah.
A video or something?
Yeah, yeah.
Okay, probably maybe a
Yeah.
testimonial?
Possibly, yes.
Yeah. And so tell us, how long were you experiencing some of those symptoms?
Oh gosh, for, at least 3 years or more probably.
So 3 or more years you were
Yes.
suffering with these problems. Things were obviously not getting better. They were
Right.
getting worse on you. You found us. We obviously did things very differently. We ran different kinds of
Yes.
tests. We did some blood work, and we did some tests that looked at your adrenals and just a variety of other different tests. And we found out some things, didn't we?
Yes.
And so over the course of time, how would you say, what's changed for you? And how would you say that your quality of life is today?
I would say my energy level is so much better, and
Yeah.
one thing that was really bothering me is my memory was not good,
Yeah.
and it always was, so that was something that was an issue with the like brain fog, and that's
Yep.
so much better now because it was kind of affecting my work and
Sure.
everything, so
Yeah.
that was very frustrating.
And so what else, what other areas did you notice improvement in? I think there was some issues that you also had with dizziness, right? Dizziness was
Oh
a big
yes,
deal.
I did have that, and that's improved like 80%.
Yeah.
So that was kind of scary.
Absolutely.
Yeah.
Yep. And tell us about your acid reflux. How much has that changed?
Oh, I don't really have any anymore.
Go
so
on.
yeah.
Go on. Check off
That's
the
nice.
list.
Perfect. Yes.
And how about your energy?
Oh, that's so much better than it was before. I mean, I just felt like so sluggish before, and just you can't enjoy anything if your energy's not up there, and so I feel so much better on that aspect.
Awesome. What would you tell someone that might be out there? They're struggling with their health. They're struggling with their dizziness, and they're struggling
Right.
with maybe depression or anxiety. They're struggling with all the things that are really
Right.
associated with those thyroid problems. What would you tell them? What kinds of advice would you give them about what you experienced here in our office?
I would say you have to give it a try, because if the other doctors aren't listening to you,
Yeah.
and you do an approach where you look at the person as a whole and
Right.
find out what their exact problems are and do each protocol, and use food as medicine, not
Yeah.
drugs, throwing drugs at things,
Right.
and then supplementing for that specific, and you take the time to do the test for that person and what's
Sure.
bothering them, where a lot of other people don't do that.
I think that's the thing that frustrates me the most,
Right.
Carol, because it's kind of like a theme that I hear over and over
Right.
and over again from so many women out there, is that for years and years, I mean, you said only 3 or 4 years or so, but for a lot of women that are out there that maybe been watching this testimony,
Right.
they've been suffering 20, 30 years not
Yeah.
getting any answers, and they just keep going back to the same doctor doing the same thing, thinking that one day something that's
Something's-
prescribed is
right.
all of a sudden going to change their life. And we have to build health rather than treat disease.
Sure. Well, that's the thing. They're just masking, throwing drugs at something, or masking what the actual problem is and not fixing the problem.
Yeah.
So, I mean, I've had doctors say, "Oh, well, we don't do those tests," and then
Right.
that's it. Then you're just like, "Okay, well, what do I do now?"
Right, right.
All
And
right.
on top of it, they don't work with patients in terms of changing their diet. And
Or
that's
even-
that's really the foundation for
Sure,
better
and
health.
I have to say, I had an endocrinologist say, I asked him about a test. He said, "No, we don't do that." And I said, "Well, should I be eating any certain way?" And he said, "No, that doesn't have anything to do with it."
Yeah, eating has no effect on your
And I
health.
thought,
right?
"Oh, well, that's interesting."
Yeah, it's crazy.
So it can be frustrating for people, I think.
Absolutely.
Which I obviously have a background in nutrition, so I know eating and nutrition is definitely a big factor. So
Huge foundation.
Right.
Yeah. Let's see here. Is there anything else that you would want to share with people that are out there that might be watching this?
I would just say, don't give up right when you're the most frustrated and you're going online for answers or whatever you're doing, or you're researching things, is when something shows up, and you should follow that.
Yeah.
Because you just don't know, and what's the point of going, the definition of insanity, doing the same thing over and over again and getting the same results.
Yep.
You should try it because it's going to work, so definitely.
Well, we'll leave it on that note, because that's
Okay.
a good note, because you're right, people do keep thinking that doing the same thing is going to result in something different.
Right.
So, hopefully, your testimonial will obviously, resonate with people out there that see themselves and being able to identify
Sure.
with the same symptoms that you had, and know that there is something that can be done to obviously get better. I want to thank you for doing this testimonial
Oh,
for
you're
us.
welcome.
And most importantly, just being a great patient and being so dedicated to your health.
Oh, yeah, it's not a
So-
problem, believe me. Especially when you feel better.
Absolutely.
Yeah,
Well, thanks again.
you're welcome.